It's Patrick Hutzel from intensivcarehotline.com with another quick tip for families in intensive care. So today I have a question from Stephanie who asks, how can I decide if the ICU team has done everything they can for my dad in ICU? Well, that's a great question, Stephanie, and thank you so much for asking it. So let's break this down. Now, after having worked in intensive care for over 20 years in 3 different countries, where I worked as a nurse unit manager for over 5 years, and after having consulted and advocated for families in intensive care all over the world here at intensivcarehotline.com for the last 10 years, I know what to look for when if the ICU team has done everything they can. And it's very difficult for families to decide that, because the biggest challenge for families in intensive care is simply that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights. And they don't know how to manage doctors and nurses in intensive care. And obviously, that's becoming very clear here in Stephanie's question. So, when someone is in intensive care, there are dozens of things happening simultaneously, starting from, vital signs displaying on the monitor, ventilator settings, if your loved one is ventilated, blood results, chest X-ray results, CT scan results, medications your loved one is on, how much urine they're making, what's their Glasgow Coma Scale. The list is endless. So how do you find out whether they're doing everything they can? Well, first off, you need to question everything. You need to question everything. You need to question the narrative, the narrative of the intensive care team. So one of the things that happens when families in intensive care reach out to us, they're saying, oh, the ICU team is negative. And, they're saying, if my loved one is going to survive, they won't have any quality of life. Well, you've got to question that narrative. You've got to look at that 90% of patients in intensive care actually survive. So therefore, the odds are in your loved one's favor. So why would your loved one be in the 10% bracket? Why would your loved one be the 1 out of 9 not surviving? So first off, question the narrative. Next, look at what's actually really happening. And often what we find when we work with our clients one-on-one, we find that the negativity of the intensive care team and the doom and gloom is actually not founded on reality. So when we look at clinical realities, when we talk to doctors and nurses directly, when we look at medical records and do a review, we often find, well, there's a lot of things working in favor of your loved one in intensive care, right? And then we can break it down, whether they're doing all the right things or whether they're not. Now, the thing that I've done a couple of years ago, I've written a blog post and made a video, what questions to ask in intensive care. And I will link to that video below this video, so you can actually have a look at what to ask. So that'll help you. But obviously, if your loved one is in intensive care with a certain condition, it's probably only someone that has worked in intensive care for a long periods of time who can work out whether they have done all the right things or not, or whether they are doing the right things or not, or whether they are intending to do all the right things or not. Often we find that patients are on a DNR without families knowing, which is illegal, by the way. So, in those instances, well, you definitely know that the intensive care team isn't doing what they're supposed to be doing. We find also things like, they're doing things like not suggesting a tracheostomy early enough, not weaning patients off ventilation quick enough. If they don't have a tracheostomy, they're saying things like, oh, they can't be weaned off the ventilator. And then when we look at it in detail, well, they haven't even tried, or things like mobilization in ICU is very, very important to recover a patient as quickly as possible. We're finding, ICU teams have become complacent. They are not mobilizing patients early enough. Very, very important, So really, when we look at it from a bird's eye view, we see very quickly whether they're doing the right things or not. And, we can help you with that very, very quickly. It really only takes one conversation with the intensive care team. It takes a look at the medical records, and then we can tell you whether they're doing everything they can and whether, most importantly, their words match their actions. And, again, most families tell us, well, the ICU team is negative. it's doom and gloom. And once again, you've got to keep in mind that 90% of intensive care patients approximately survive. So again, the odds are in your loved one's favor. There's no need to be negative, right? There's absolutely no need to be negative. It should be an optimistic outlook, but they're not doing that because they want to manage their downside. They want to manage their liability. Please keep in mind that if they tell you, well, your loved one's got a pneumonia in ICU, we're doing this, and this, we're giving antibiotics, we're ventilating your loved one, putting them in an induced coma, and then after a few days we take them out, and then off they go, recovered, and go to a hospital floor or a hospital ward. And then it won't happen, or it doesn't happen. Then you could sue them, you could hold them accountable for misleading you, and that's why they're often doom and gloom and why they're negative, because that's how they manage their downside. And if things don't turn out well, they can tell you, well, I told you so from day one, right? So it's important to stay in control of the narrative so they can lead you and often mislead you. So I hope that helps how you can decide if the ICU team has done everything they can. You can't really, without having a second opinion, without having us help you, looking from the outside in and breaking it all down to you into the fine details, which is important when it comes to intensive care. It is often going down a rabbit hole, but that is what is important and what you need to do. If you want to make informed decisions, have peace of mind, control, power, and influence, it'll be very difficult for you without a clinician on your team that can give you a second opinion. So that is my quick tip for today. If you have a loved one in intensive care, go to intensivecarehotline.com, call us on one of the numbers on the top of our website, or send us an email to support@intensivecarehotline.com. You can also book a 15-minute free phone consultation with me. And you can do that by clicking on the Make an Appointment button on our website at intensivecarehotline.com. Also, have a look at our membership for families of critically ill patients in intensive care. You can get access to the membership when you go to intensivecarehotline.com, click on the membership section, or go to intensivecaresupport.org directly. Also, and in the membership, you have access to me and my team 24 hours a day in the membership area and via email, and we answer all questions intensive care related. Also, have a look, and I do one-on-one consulting and advocacy over the phone, via Skype, via email, via WhatsApp, whichever medium works best for you. Right? And I talk to doctors and nurses directly. I talk to you and your families directly. I ask all the questions to intensive care teams that you haven't even considered asking, but you must ask in order to find out if ICU teams are doing everything they can, right? I also represent you in family meetings with intensive care teams. I would not go into a family meeting if I was you without an advocate and without a written agenda of the meeting before you go there. You will need clinical representation in a family meeting, otherwise you won't stand a chance. Been there, done that hundreds of times in family meetings. You need to either not go or have clinical representation from myself as an advocate. We also review medical records in real time so that you can have a second opinion in real time. Once again, it helps you to make informed decisions, have peace of mind, control, power, and influence in situations when you have a loved one in intensive care. We also review medical records after intensive care if you have unanswered questions, if you need closure, or if you are simply suspecting medical negligence. Now, if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, comment below what you want to see next or what questions and insights you have from this video, and share the video with your friends and families. Thanks for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.